Sue, a 56-year-old woman, was diagnosed with Huntington's disease several years ago. Since then, she's been visiting the Department of Neurology at Wayne State University for monitoring and treatment. Her disease and symptoms, including her HD chorea, have progressed over time. Chorea causes uncontrollable movements that can appear as jerky, twisting, or writhing motions. While assessing Sue's HD chorea, her doctor, John Kamholtz, asked her to do many different tasks. He observed Sue carefully to see which parts of her body were affected by HD chorea. Dr. Kamholtz uses a validated rating tool called the Unified Huntington's Disease Rating Scale, or UHDRS. The scale was used during Xenazine clinical trials. As part of the UHDRS scale, there is a total chorea score rating, where 0 means no chorea and 4 means a lot of chorea. It allows Dr. Kamholtz to observe and score the impact of HD chorea on different parts of the body. The scale is useful to help identify changes in HD chorea over time. Using the UHDRS scale, Dr. Kamholtz determined that Sue's total chorea score was moderate, with some areas of her body more affected than others. After taking Xenazine, Sue went back to see Dr. Kamholtz, who again evaluated her HD chorea. There were some improvements. She still had symptoms of HD chorea, but overall they were milder than before. Sue's total chorea score improved from 17 to 11. The changes in Sue's total chorea score reflected changes that were observable.
The Xenazine, reduces the amount of chorea, and really the most important for her really would be the chorea in her legs and the chorea in her trunk.
Every time Dr. Kamholtz sees Sue, he assesses how she's doing. In addition to evaluating her HD chorea, Dr. Kamholtz also determines whether she's having any side effects from Xenazine. It's important to monitor for signs of depression and suicidality, along with the other serious side effects associated with Xenazine. Please review the important safety information for Xenazine tetrabenazine, including boxed warning for increased risk of depression and suicidality, available with this video.
During Sue's treatment, at some point she became somewhat sedated on the standard dose that she had been on before. And once we recognized this and lowered the dose, sedation really was improved.
The most commonly reported side effects in studies with Xenazine were sleepiness, trouble sleeping, depression, tiredness, anxiety, restlessness, agitation, and nausea. Individual results for people taking Xenazine may vary. In clinical studies, 70% of people taking Xenazine had fewer or milder chorea symptoms. However, in 30% of people taking Xenazine, chorea symptoms got worse or stayed the same. If you have symptoms of chorea associated with HD, again, please talk to your doctor about whether Xenazine may be right for you. Indications and usage. Xenazine is a medicine that is used to treat the involuntary movements, chorea, of Huntington's disease. Xenazine does not cure the cause of the involuntary movements, and it does not treat other symptoms of Huntington's disease, such as problems with thinking or emotions. It is not known whether Xenazine is safe and effective in children. Important safety information. Xenazine can cause serious side effects including depression, suicidal thoughts, suicidal actions. You should not start taking Xenazine if you are depressed, have untreated depression or depression that is not well controlled by medicine, or have suicidal thoughts. Pay close attention to any changes, especially sudden changes, in mood, behaviors, thoughts, or feelings, or worsening depression. This is especially important when Xenazine is started and when the dose is changed. Do not take Xenazine if you have liver problems or are taking monoamine oxidase inhibitors or reserpine. Ask your doctor or pharmacist if you are not sure. At least 20 days should pass after stopping reserpine before starting Xenazine. Tell your doctor if you are pregnant, breastfeeding, or have breast cancer. Do not start any new medicines while taking Xenazine without talking to your doctor first. The need for therapy should be evaluated on an ongoing basis with your doctor. The dose of Xenazine should be adjusted slowly over several weeks for a dose that is appropriate for you. Tell your doctor if you stop taking Xenazine for more than 5 days. Do not take another dose until you talk to your doctor. If your doctor thinks you need to take more than 50 milligrams of Xenazine each day, you will need to have a blood test to see if a higher dose is right for you. Neuroleptic malignant syndrome, NMS, is a potentially fatal side effect reported with Xenazine. Call your doctor right away and go to the nearest emergency room if you develop these signs and symptoms that do not have another obvious cause: high fever, stiff muscles, problems thinking, very fast or uneven heartbeat, or increased sweating. Xenazine should be stopped immediately if NMS is diagnosed. Xenazine can also cause other serious side effects, including Parkinsonism, slight shaking, body stiffness, trouble moving or keeping your balance, restlessness, akathisia, trouble swallowing, irregular heartbeat, and dizziness due to blood pressure changes when you change position, orthostatic hypotension. Trouble swallowing may increase the risk of pneumonia. Uncontrolled movements called tardive dyskinesia, TD, may also develop in patients treated with Xenazine. It is possible that the TD will not go away. Side effects such as irregular heartbeat, NMS, and Parkinsonism may be increased when using Xenazine with other drugs, for example, dopamine antagonists. Sleepiness is a common side effect of Xenazine. Do not drive a car or operate dangerous machinery until you know how Xenazine affects you. Alcohol and other drugs may increase sleepiness caused by Xenazine. Some side effects, such as depression, tiredness, trouble sleeping, sleepiness, Parkinsonism, agitation, and restlessness, akathisia, may be dose-dependent. If the side effects don't stop or lessen, your doctor should consider lowering the dose or stopping your Xenazine. The most commonly reported side effects in studies with Xenazine were sleepiness, trouble sleeping, depression, tiredness, anxiety, restlessness, agitation, and nausea. For more information, please see the full prescribing information, including boxed warning, the medication guide, or go to www.xenazineusa.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.